Hello there. So a lot of you have been asking to see some of the optical equipment and for me to explain how it works. So I've put together a collection of items that I would use for a domiciliary eye examination. So first up, we are going to need a trial lens set for refraction. So we have your concave lenses there, correcting any myopia, your convex, correcting hyperopia. So these lenses slot nicely into the trial frames that I'll show you later. You're going to need your accessories and of course your cylindrical lenses here. Now some optometrists work in minus form and some in plus, so you have both options there. Added benefit of the crinkly sounds. But just excuse me, I'm getting a little bit carried away there. Additional lenses. If I can coax this out. We have your flipper lenses. So you can adjust the distance between the two sets. You have your plus 025 and minus 025, and you can refine the reading addition for any presbyops there, binocularly. So the 025 flippers. Of course, when refracting, checking your astigmatism, axis and power, you're going to need your Jackson cross cylinders there, which you present to the patient. Ask them which is the clearest. We have an 025 and a minus 050 for you there. So, corrective lenses for refraction, minus, plus, a bit low on the prisms, so we'd use the prism bar. So that's your first item. Let's move on to item number 2 now. Okay, so we have some stuff at the back here, which I'll come to, and some stuff in the base here. So what are we going to look at first? Okay, we have our Budgie stick here. Great for fixation. 2 smaller images there. We have a near Snellen equivalent here for checking vision. And for any non-English speaking patients, check vision with the tumbling E chart there. A passage of N5 print there. So I could use this for convergence. Could use it for ocular motility. And we can use the fixation targets for a near cover test. So that's the Budgie stick. That leads us nicely on to the cover test using the occluder here. And as well as an occluder, we have other functions here: pupil size measuring scale, another fixation point, scales for intricate ocular measurements such as vertical apertures, for inches scale there, and we have this useful one here, again for things like vertical apertures or iris diameter measurements. So that is the multifunctional occluder there. The goal with any domiciliary visits is to try and be nice and streamlined. Try and acquire any multifunctional tools, which leads us on nicely to the Shamir reading test. Not just reading test, as you'll see. So first we have our near passages coming from point N25 all the way down to N3. In the absence of pathology, I'd like my patients to get to around N5 and N4 if possible. Okay, mini Ishihara plates there. Just a few items here for questioning. Duochrome for near refraction refinements. Again, we said we're looking for multifunctional items. Here is the Amsler grid, checking for any problems at the macular zone there. You see me use that many times in the clinic. So another great item there. Right. Now we did say we had a mini Ishihara there, but if we're more concerned, the patient has a colour defect, you can use the Farnsworth D15 test here. So you have a collection of coloured caps. This is going to screen for the three main types of colour defects. I believe protanopia, deuteranopia and tritanopia. For reference cap, mix these ones up and the patient attempts to match to the colour to their left until they have completed the test. And then we classify using the sheet what type of colour defect they appear to be showing. Trying to get things flowing in a nice order, as well as our near tests with fixation, convergence, motility. I will then whip out the ophthalmoscope here and use the light source and varying brightness to check the pupil reactions. I can use it to check the corneal reflexes at approximately 1 metre, and then we can go in and have a look at the structures of the eye very close. So I look through the viewing portal there. We have an extension of power ranges for those high prescriptions. We have 4 apertures there, white, red free, which is green, cobalt blue, and yellow there. We also have a range of apertures, pinhole, medium, large, we have our slit aperture, and then our target there for eccentric fixation checking. So again, we use the ophthalmoscope multiple times in the clinic. And of course, after we've looked at the back of the eye, we need a nice grading scale. It's going to help us classify any particular findings or structures we are looking at. So it's pretty self-explanatory. So this is an inverted lid, top lid, looking for any papillary conjunctivitis. This is certainly some of the more serious stuff there. A corneal neovascularisation. A couple of slit lamp type techniques there. Epithelial microcysts, corneal edema. Okay, and we have a lid pathologies, blepharitis, meibomian gland dysfunction, keratoconjunctivitis involving the cornea and the conjunctiva, and so on and so forth. In your 60 plus patients, you're going to be seeing plenty of cataracts. We can grade the age-related type cataracts there. 3 main ones: nuclear, cortical, posterior, subcapsular. And please bear in mind that patients can have combinations of these cataracts. That is another useful grading scale there. And you record the findings, of course, on your record card. Okay, this is going back to the trial lens set. You're going to need a trial frame, of course, of Mr. Heap, Chris. There we go, trial frame. So, adjustable sides. You have your lens slots at the back and the front. You have an adjustable scale there. Just centre these using the scale there. You'll know that measurement if you've done your pupillary distance taking. Rotators for your astigmatic checking the axis, and these alter the angle of the side there, those little knobs. So, trial frame is imperative. Also you have your adjustment for the nose rest there, and this one locks it nicely into place. Keep this set perfectly. also relating back to our refraction, we're going to need ourselves, of course, a retinoscope. There she is. Right, so retinoscopy is quite a tricky test to describe to you. But essentially, we're using this beam of light and sweeping it in various directions, checking the movement in the eye, and then using the correct lens to neutralise the movement. So if we sweep up and down and we're getting a with movement, we neutralise that movement with plus lenses, and if it's an against movement, neutralise with the minus lenses. Pretty sophisticated piece of equipment. Brightness button, canister and battery within. If we for some reason don't have our trial lens set, we have these handheld lens racks, a lot more efficient to neutralise the light we were just talking about. So there is your minus lenses for neutralising against movements, ranges from 0.5 to 15 diopters there. And of course black is denoted, or plus is denoted by black. There you go, plus rack. Again, 0.5 to 15 diopters. There, so hold that in front of the eye. Use your retinoscope through the little portals there to neutralise the light. Take off the power for your working distance, and then you can work out the refraction there. But obviously, if there's any astigmatism, you're going to need to neutralise those with lenses from the trial lens set. Right, what is important to the patient? Well, if you found anything untoward, or you want to give them further advice about their referrals, you're going to need some information booklets. There's one about ocular hypertension. And obviously these information booklets are updated all the time, so you need to stay up to date and relevant. Now, Spa Medica offer YAG capsulotomy service, essentially using a laser to clean the intraocular lens that is placed in following cataract surgery. A very common procedure I find in the clinic that needs to be done. So you have information on that procedure so that the patient is armed with knowledge and hopefully a little bit more relaxed. As they say, knowledge is power. Another macular sheet for the patient to take home, macular grid, which they can check themselves. Right, coming back to when we had the fixation stick, this was hiding on us. This is the red dot stick. There we go. Again, good for ocular motility, convergence, and also can be used for a red desaturation test. Although when I usually perform motility, I like to do it with the ophthalmoscope, so I can observe the corneal reflexes as well. But these are quite good for your paediatric patients due to the bright colours. Right, for ocular measurements, the Rees-Fairbanks rule here. You've seen me use this in measuring videos, checking apical radiuses, bridge projections, display angles, frontal angles, crest heights, length to bends, things like that. Head width, temple width. Again, another multifunctional, great bit of kit there. Tropicamide eye drops, important if we need to dilate those pupils. But obviously we need to do a few checks before just squirting this in the patient's eyes. As well as checking the anterior angles, I want to check the intraocular pressures, just in case tropicamide causes some kind of angle closure, causes the pressure to shoot up. I would check the intraocular pressures. For domiciliary visits I can use the Perkins or the eye care. But of course the eye care requires now anaesthetic eye drops. That is the probe holder. That is your activation switch there. That's your toggle button. If you're one for resting against the patient's head, have your forehead rest there. But I usually just use my hand like this. Batteries in there, and of course your clean, sterile tonometer probes here. Single use, please. I have heard of some heathens who will wash these and reuse them. That is a big no-no. That is not safe at all. There is the part that flicks the front of the eye. Once loaded, flicks the eye and calculates the intraocular pressure. 6 readings please per eye. And if you suspect conjunctivitis, for example, in one eye, you will use a fresh, clean probe for the neighbouring eye. Extremely important test there, tonometry. As you can see there, just a little pad, sheets for recording pressures. Okay, you've finished your eye exam. You've got your refraction. You've taken your measurements. This isn't by any means a complete set. But you're going to want some frames for a potential dispense for the patient. So this is just a few frames that the patient can try on. You could show them some tints if you offer that in your lenses. We have some metal frames. We have a nylon frame there. Another metal. and plastic, so obviously you can tailor your spectacles to whoever you're going to see. So I hope you've enjoyed this little tour of the optical equipment, and I've managed to hopefully explain how some of it works. I will see you next time.